Hello, everyone. Welcome back to BBB Sharing. I'm Evie, Director of Ignite, sparked by BBB. And with me today, I have Barry Moore, our CEO and President.
Hello.
Good morning. And also, we have a very, very special guest today from the Virginia Department of Health, Dr. Lori Forlano. Dr. Forlano, you are the State Epidemiologist, correct? And you also are the Director of the Office of Epidemiology.
Yes, that's correct.
Perfect. For those of the who don't know, what is epidemiology?
Yes, it's funny because I think the last several years, many people have become a lot more familiar with epidemiology because of the pandemic. But in general, what epidemiology is the study of the distribution of disease. So that's the short version. But what we do is try to understand trends of diseases, what drives increases or decreases, what populations are impacted. And I think a lot of people think about epidemiology when it comes to infectious diseases. That's what my office is most focused on, but really epi can be applied across all kinds of diseases as well.
So even hereditary ones?
Hereditary, chronic disease, heart disease, cancer, etc. The practice and methods of epi can be applied across the board.
So I do have a few questions prepared. And I'm going to let Barry answer or ask the first one.
All right. So how does your work in the population health address the disparities in health outcomes across the different communities in Virginia? And what role does health equity play in your strategic initiatives?
Yeah, that's probably one of the most important things we do and one of the most challenging things we do. So my work is mostly focused on what we call applied epidemiology. So we gather lots of data. Our teams analyze that data. You might see dashboards or graphs or things like that on our website so you can understand what's happening for a particular disease. And we're focused on populations. So people in public health often say that the population, the community is our patient instead of an individual person sitting in front of a healthcare provider. We're worried about everyone in Virginia. And of course, certain conditions are going to impact different populations for different reasons. And it's our job to try to understand that. So when I think about population health, my teams work to help us understand the trends of diseases. Oftentimes we can't get to a specific answer. For example, with an outbreak, we might not always know what's causing it, but we have hypotheses that we test. And then we also, for equity, to your question, we want to understand which populations are impacted. And that can be teased out in a variety of different ways: age, gender, race and ethnicity, income, geography. I mean, you name the demographic factor. If the data is available, we can try to understand that better. And then more importantly, we want to go upstream, so to speak, to mitigate or prevent the disease from happening in the first place, or at a minimum, reduce the harm associated with a particular condition. Unfortunately, our world is not a sterile one, so diseases happen, but we do try to mitigate the harm that's associated with those diseases. And where we can prevent disease, we should, and we should do that equitably across all populations. But these are really complex issues, which are hard to tackle.
So with your background in epidemiology and preventative medicine, how important is community engagement and education in preventing and controlling, disease outbreaks?
It is probably the most important factor in what we do. I'll say from my seat, I understand the importance of that engagement. Other than opportunities like this, I can't say that I specifically am doing that engagement. That happens at the local level, as it should. Those are where the relationships are built. Those, whether it's with local businesses or healthcare systems or nonprofit organizations, faith-based organizations. During the pandemic, when we were trying to get out really life and death messages about how to keep healthy and safe, whether it was staying home when you're sick or learning about vaccines, etc. Some of the most effective messaging happened really at the grassroots level, so to speak. So whether it's someone's church or YMCA or local barbershop or all kinds of different places in a community where people connect, that's where those messages are often best delivered and best heard. And you need messengers that are part of a community. I live in Richmond, Virginia. My voice might not be as powerful in other parts of the Commonwealth. As a local pastor or business owner or someone like that we can partner with, and that's where we see the most effective public health happen.
I have to agree that it does tend to be more grassroots, like you said, that people are more aware of things like that. You want me to ask one? Can you explain the role of the Office of Epidemiology in monitoring and responding to public health threats, and how do you ensure that Virginia is prepared for potential outbreaks like COVID?
Yes, this is one of my most favorite questions. So the Office of Epidemiology is a very big, complex office at the Virginia Department of Health. So we sit at the state level. We physically sit in Richmond, Virginia, in the capital. My office includes multiple divisions. So we have programs related to immunizations. I have a division that's devoted to HIV and sexually transmitted infections, prevention, detection, and control. I have a whole team that's focused on what we call informatics. So that's the production of all of the dashboards that you see and the pipelines of data that we're getting into the health departments and producing visualization so people can understand all of the numbers simply and quickly. We have our bread and butter we call them epi teams, field investigation, surveillance and investigation. So those are the people that collect all the data, look at it. If you are diagnosed, for example, with me think of a good example, pertussis, which is whooping cough. So we're seeing increases in pertussis, actually pretty alarming increases in Virginia and nationwide as compared to some prior years. So if you're diagnosed with pertussis or your child is, our EPIs in the local health departments you'll probably get a phone call from one of them and they'll talk to you about your symptoms and try to understand if you have any people close to you that might be vulnerable to that condition if they're not already vaccinated, et cetera. So they do those investigations. Sometimes they bubble up into outbreaks, and then our EPIs are in the field, whether it's in a nursing home or a school, a restaurant. There's all kinds of settings in which outbreaks can happen. So my team writes the guidance and helps provide some direction to the very talented, very skilled people in the local health departments that are all over Virginia. Virginia is very fortunate in that we have local health departments across the Commonwealth. Not every state is set up that way. We have pretty just rock star teams in the local health departments. Every local health department has an epidemiologist. Some have more than one, depending on their resources. Let me think what else we have. We also have a clinical epidemiology team. So that's the team that's working really closely with healthcare facilities. So there unfortunately are outbreaks of disease that happen in healthcare facilities sometimes due to a variety of different factors. Antibiotic resistance is an emerging issue in healthcare and public health. So we have a team that helps that issue be addressed. We have infection preventionists that work with healthcare facilities and hospitals to teach them different infection control practices to prevent transmission of disease. There's a whole variety. We have a pharmacy at VDH that does tremendous work in providing our local health departments with drugs and vaccines, but also with community partners as well. They've been really involved. And one thing we do that's not related to infectious disease in EPI is our pharmacy runs an naloxone distribution program. So I'm sure you've seen in the news and lots of stories both in Virginia and nationwide that the overdose or opioid epidemic has had a really concerning increase over the last several years. And one of the ways we mitigate that is by distributing naloxone, which is an overdose reversal drug, for free to community partners that can distribute it to people who need it the most and may not have the means to get that drug on their own. So that's an example of
That's
something
amazing.
that we do. So we have a big breadth of work. In Epi, we also have a zoonotic disease team. So if you have a bat in your attic, that's one of the most common questions local health departments get. Those calls go to the local level, but we have a public health veterinarian on staff that helps advise if you think you've been exposed to rabies or you were bitten by a dog, things like that. So there's, I think there's a lot of things that local health departments and the state health department manage that are unseen by the public, but are happening behind the scenes or behind the curtain to make sure everybody is safe and healthy. Some of that came to light during the pandemic when many people learned what a health department was for the first time. But we do a lot more probably than what people realize.
You all do truly have so many resources available for the public. And I feel like I can always hearing, there are no resources, there aren't enough resources. And I'm thinking to myself, now having this position that I have and meeting so many of you, that you all have numerous resources. And I'm like, what are people talking about?
I mean, we have the health departments, the local health departments offer a lot of services to clients, some of which are connected to my office, some aren't. So that's everything from nutrition services, prenatal care, immunizations, HIV testing, STD testing. There's lots of different services, the baby care that are offered at the local level. We could always use more resources, but we do a lot on a small budget.
You all are really amazing. But one of the things that I did also, and while we're on the topic with outreach things and resources, I understand you're not involved with the Center of Community Health Improvement anymore, but during your time there, what were some key initiatives or programs that you all implemented that, affected epidemiological data that you all received?
Sure. So the Center for Community Health Improvement is a small but mighty team at the state level, the Virginia Department of Health. It's had a few different homes. I was fortunate to work with them when they were under my purview for a while. They've since moved to what we call the Office of Family Health Services. So CCHI, they help organize, structure, advise, consult on a few things. One method that's used at the local level is called a community health assessment. So that's just what it sounds like, where local health departments gather a lot of data. They talk to local stakeholders, private sector, healthcare, community organizations, faith-based organizations, to understand what health issues are impacting a community, what health issues the community feels like are most important. And sometimes those two things aren't necessarily the same. So you need to come together to agree there on priorities, and then resource development, figuring out how to address those problems. So there is a methodology to that, to describe the health of a community, and then the development of a community health improvement plan. So once you figure out what the problems are and you agree upon the priorities, how are you actually going to attack that and make your community healthy? And it is supposed to be more systems level. So is there food access? Is there a pharmacy that's within reach of most people? Big issues, like that. How are you working with your schools or your churches or, I don't know, your local fitness center, food banks? So it's a network, businesses, it's a network of community stakeholders that come together to prioritize health and action. Again, there are short-term solutions and then much longer, complex solutions that come out through public health. Epi data or epidemiologic data helps inform those plans. So we like there to be quantitative information. We like it to be based on science and facts. Obviously, the qualitative information or the stories you gather from people is also equally important. input into that process. So that's how I would say those two things are linked. Some people see things like the county health rankings. I don't put a lot of stock sometimes into I'm a more collaborative person by spirit than a competitive person, but I understand a lot of people are driven by being at the top, and that's understandable. But you have to really look pretty deeply into those rankings and what goes into those things. A lot of it sometimes is wealth, resources in a community, but it's also community investment and where are we putting our dollars and cents to prioritize health, broadly speaking, for the people that live there.
Yeah, that makes a lot of sense.
So moving forward, so when you go back to your office and you're with your peers, you're seeing the Ignite Center now, and how we want to, as Evie calls it, as the director here, there's Band-Aids, and those are called things like the food bank's a Band-Aid for a situation. It's a great Band-Aid, but what is the root cause?
Right.
So we are not like all the other organizations. We're a nonprofit, and we encourage this relationship with your team, your department, the health department, with the Commonwealth, Janet Kelly down, to really help us facilitate conversations about why are we having an issue with fentanyl? Why is the mental health so gone in so many ways, and suicides on the uptick? I have 3 people I know within 2 months this year that committed suicide, and I just learned of a 4th. And that's just in my network. I'm only 63 years old, and I'm not even from Virginia. These are all people around here. So it's alarming, right? And so we're working with that. We have 988 coming here on Wednesday. We're going to be talking about food banks in the future. Why can't people get food at a grocery store and fix it? Because every statistics, the food bank, the food insecurity is going to be up 10% this year.
10%.
10% users. We're not fixing anything. We got to look at what we're doing. So I look forward to, you never know why you meet people and why you're here. And it's just telling a story. I would like you just to touch very quickly. I know you're almost out of time, but we tell a story to the community, and we work on job creation, job placement, how to interview, how to hold a job, respect, integrity. That's what we stand for as the BBB. And so we try to input that in. And then so we're working with work-based learning in the Commonwealth, and that's employers hooking up with schools, giving internships. And then we're working with military. Evie's heading that program up for us. And then we got seniors that are retired, but they don't want to be retired. And they're great employees, right? And ambassadors. The best ambassador I had was Sheriff C.T. Woody. He's retired, but he was my ambassador here. And he was great because he has a passion for the people. How do people get into your field is what I'm asking.
Yes. Love it. And your earlier comments, you sound like a public health person, when we have these downstream solutions, but we really need to go upstream to big picture solutions. Public health, really, I think, is one of the most innovative emerging fields that there can be. So if you are a person who enjoys creative problem solving, but also this is true public service, really helping your community, big or small. You can start by just walking into your local health department and learning what they do. Go to their website. If you're a young person or a person, kind of reinventing yourself, there are Masters of Public Health programs, which that's their more formal education, but a great entry into the field. And public health is really diverse as far as the things you can do. You don't have to be a physician or a nurse. We certainly welcome those professionals in public health, but there's lots of different ways you can plug into public health. Everything from, we have engineers, nutritionists, we have people with marketing backgrounds, because really public health is all about getting the message out to people. And sometimes we're not the best at that in government. We're trying to get a little bit better. So that's where I would start, and certainly give us a call. There's also a medical reserve for very large contingent of volunteers associated with the Virginia Department of Health, and they want people from all kinds of backgrounds. So if you are someone who's maybe at the tail end of your more traditional career and you have some time to spend, that's a great way as well to plug into public health, and we welcome that support.
It's great. Learned a lot.
Where can people find all of the resources that you all have?
Yeah, I'd start with vdh.virginia.gov, and you can also get plugged in through that website to your local health department, and that's where the action happens.
Perfect. Everyone, thank you for listening and watching. If you're watching on YouTube, please make sure to like, share, subscribe, and comment down below. It really helps the algorithm out. If you're listening on Spotify, make sure to follow us and share the Spotify out. You never know who's stuck in traffic and needs something to listen to.
Thanks for having me.
Thank you.
Great meeting you. Thank you.